here we go, once again debating something that is now the law, that is proven to provide services to Americans, whether they are seniors or whether they are young, whether they are children. It works, and it's working for America today.
Well, if I might ask the gentleman from California if he would yield. I believe there's a whole lot of political posturing going on with the Medicaid decision by states. And, you know, you're hearing a lot of talk about, well, we're not going to pay for that portion because, well, while it may be 100% in the near future, it may go to 90% into the long-distance future. And they don't want to pay anything for the new installment of a Medicaid plan. Well, today we're paying. It's not like it's against an absolute that costs nothing. If you have the poor, uninsured, underinsured, in any given state, there's indigent care. There's bad debt and charity that is addressed in ratepayer dollars for insurance coverage sake, because that is going to be incorporated into the overall actuarial plan, or you're paying for it through taxpayer dollars, and for a much more inefficient system. To have the poor and uninsured and underinsured to go to emergency rooms, visiting a different doctor team every time they visit that emergency room, or perhaps a different emergency room, to not provide the stable, standardized care, acceptable notions of how to provide a predictable outcome, you're going to pay needlessly and wastefully. And this is about networking people to a system that provides a stability, a standard that will enable them to have a clinic, have a contract that will cover them and make certain that all of us are strengthened by it. And guess what? The business community, we talk about competitiveness. We talk about a sharp competitive edge for America's business community as they enter into the international sweepstakes on winning contracts, and that translates into providing jobs and profitability for our business community. Well, part of their cost of doing business is to have health care for their workers. Many want the health care coverage for their workers, but simply cannot afford it. And so the exchange opportunities that are part of the package of Affordable Care Act enables them to cut their costs. It's taking their experience, their actuarial experience of 10, 15, 20 workers in that small business, and putting them in a pool of millions of workers that enables them to shave the peaks and enables them to take those catastrophic situations. One person in their plan of 10 impacted by catastrophic situations can cause their premiums as a company and the co-payments of their workers to skyrocket. But if they're enabled to join this pooled effort, it provides for a better outcome for everybody. So there is wisdom and thoughtfulness poured into the reform elements of the Affordable Care Act. And it's done again with that American heart, that spirit, that sense of compassion for the worker, the sensitivity toward the employer, and putting together a package that has everyone responded to in a way that speaks to a long overdue bit of success. The last industrialized nation, Representative Garamendi, to go toward a guaranteed health plan. So long overdue, and now to taste success and have it pulled away from the American healthcare consumers of this great nation is a very troubling notion.
Well, Mr. Tonko, thank you very much. Next Monday, did you know, next Monday is the birthday, the annual birthday of Medicare. Next Monday. 1965, it went into effect in 1965, and ever since, as you said earlier, Republicans have been trying to terminate it. They tried again this year, but the American public knows better. They know